My name is Professor Lora Fleming. I'm the director of the European Center for Environment and Human Health at the University of Exeter Medical School. It's an interdisciplinary center that looks at the interconnections between our health, human health, and the environment. I was the original principal investigator of the MedMe project, and I did this in collaboration with amazing people from the Met Office, Public Health England, London School of Hygiene and Tropical Medicine. And our vision was that we wanted to look at the interconnections between human health and the environment, but there was no way to do it easily, particularly from the point of view of big data. So you have these two very different communities. You have the medical public health community busily collecting data on humans, and then you have the environmental science community writ large collecting huge amounts of data on the environment. And that could be things like 100 years of daily rainfall data. And they're very different types of data. They're very different types of culture. But to our knowledge, there was no way to kind of easily link these data and to look at big issues of climate and environmental change and how human health and well-being fits into that. And so that was the original idea behind the MedMe project, was basically almost a feasibility thing. Can we try and do something in this space that will attract researchers and other communities to work with these data? And can we also make it easy to work with those data? So the big picture was to try and create some sort of platform accessibility to these huge data sets that are out there that are measuring, in a sense of surveying or monitoring, the health of the environment and the health of people, and provide a space, or we call it a platform, where researchers and others could actually access those data, link them, and answer big questions. So one big piece of this was to explore the potential linkages between our health and the health of the environment during a time of climate and environmental change, which is only revving up now. I hope that this video will illustrate to you how a community forms, how its users are involved, how the people that actually created this community, what their thoughts were and what their challenges were, and also how this resource is now taking on a whole new area, collaborating strongly between the Met Office and Public Health England to provide a data resource for a much wider community.
I'm Holly Lam. I am a postdoc from the National Heart and Lung Institute of Imperial College London. So I am interested in environmental epidemiology, and here in National Heart and Lung Institute, I'm also working on some project looking at allergy and environmental exposure.
I'm Jess Tyrrell. I'm a senior lecturer at the medical school, and I'm a big data researcher who focuses on both vestibular conditions and looking at the links between metabolic and mental health.
Yeah. My name is Penny Murage, and I work in environmental epidemiology at the London School of Hygiene and Tropical Medicine.
So I'm Dr. Francis Rowney. When I was using the MedMe platform, I was working for the European Center for Environment and Human Health, part of the University of Exeter. And I was working on a project looking at links between grass pollen and respiratory health.
Data linkage is crucial in the kind of research I do. I work with big data a lot, and we use different data sources to create a better data set to enable us to address key questions.
So, generally speaking, when we look at environmental epidemiology, we often find that there's multiple pathways from environmental exposures or hazards to the impact on human health. And quite often then unpicking those pathways requires use of multiple data sources. And sometimes what we find is that those data sets are collected by different people, different organizations, and they're never in one location, and they also come in different formats. So data cleaning can take quite a long time. So it's always helpful when you find a resource such as MedMe, where someone has done all that hard work for you.
So in this study, we mainly look at the seasonality of food anaphylaxis and its association with pollen count. From this platform, we obtained the pollen data. So we basically obtained the data between 2010 to 2018 from April to August in each year. And we took average of these pollen data from 6 monitoring stations within England, and then we summarized these to our monthly mean to match with our monthly hospital admission data. And then we applied these pollen data as an explanatory variable in our monthly time series regression model to look at its association with food anaphylaxis.
The MedMe platform provided us with an opportunity to link data from a health app that records symptoms from individuals with Meniere's disease, which is an inner ear disorder characterized by hearing loss, vertigo attacks, and tinnitus. And the work came about from discussions with one of my ENT consultant colleagues who suggested that the weather affected symptoms. And we had no evidence base for that apart from one paper where 10 people were asked and more than half said, yes, the weather affected their symptoms. So this seemed to be the evidence. And we thought we must be able to do something better. So we had data collected on the app where we had people's GPS location. And we then used the MedMe data to link in weather data to the nearest location from the nearest weather station to our app data. And we were able to then test the hypothesis that various weather factors influence the symptoms of Meniere's.
So my research involves measuring the health impact of environmental changes with a specific focus on climate change. And so what we did and what we do really is we extract the daily records of temperature and humidity, for instance, across several decades. And we create what we call a time series table. Then we go on and link those weather variables with health-related data sets. So in our case, it's daily mortality as well, so things like death counts. And these are collected by the Office of National Statistics. So when you combine those two data sources or those two records, we then run some statistics. And then it's possible to estimate whether any change in weather or whether change in temperature also is related to any increases in mortality.
So the project we were doing was looking at whether the respiratory health impact of grass pollen might vary between different grass species. And we were working with a team of molecular ecologists who developed a new way of monitoring grass pollen using environmental DNA techniques. But as part of that research and as part of building the regression models to answer those questions, we needed access to standard pollen monitoring data from the Met Office. And that's where MedMe came in. It was a really convenient way to pull all the standard grass pollen data from the years that we wanted for all the locations we wanted in a really efficient way.
So we might be able to find some other variable as a proxy of the pollen exposure, like referencing to Pollen Canada, but this highly likely will compromise the accuracy of exposure estimation. So yeah, this data set is essential in our analysis.
If we'd have not had the access to MedMe, we wouldn't have really been able to test our various hypotheses. The wealth of data that was available through MedMe and the different weather variables, for example, atmospheric pressure, temperature, rainfall, thunderstorms, we didn't have that data readily available for all the different weather station locations. We might have been able to get sort of a regional specific weather, but with this, we were able to really use nearest neighbours and nearest weather stations to get a much more accurate picture of the weather within that region.
In terms of the temperature data, I think that we can access from other places, so there are other sources of temperature data, but it was obviously easier to retrieve that from MedMe for our use. The relative humidity data sets are much more difficult to come across. In fact, I don't know whether we would have gotten any relative humidity data across the times that we are looking at. Like I said, we look at several decades. But I guess it was just really useful to have those sources of data in one location, and it was very easy to pull them out. But additionally, I guess with the temperature data, in one specific project, we wanted to understand whether there are any neighborhood factors that increase or reduce mortality. And it was helpful to obtain many data at a very fine resolution. So I'm talking of something like 500 meter, which is really, in fact, I guess it's impossible to get it from anywhere else.
It really just helped grease the wheels for that sort of thing. Just having the that sort of data really readily available and really easy to access, it just, it saves a lot of time in chasing up different people to try and get the data, or chasing around different websites and that kind of thing. So you can spend more time actually working with the data rather than trying to chase it.
So in summary, that we found that pollen count is likely to be associated with food anaphylaxis hospital admission within England, but we have to be very careful when considering the results, because due to the nature of our health outcome data set, we could only conduct monthly basis analysis, and we had to assume same exposure across England. So in the future, we definitely need another analysis that we find a resolution in terms of spatial temporal resolution to confirm the finding in this analysis.
Yeah, the ENT consultant was correct. There is a role for the weather in the symptoms of Meniere's, and we were able to do various different analyses, including looking at the weather the day before and the symptoms the day after, and vice versa, and show that atmospheric pressure in particular was a trigger. So low atmospheric pressure resulted in people having attacks of vertigo. And there were some other weather variables that were also slightly implicated. So it was really interesting that, on the basis of one paper where 10 people were asked, does the weather affect your symptoms? And they said yes, there was actually a much more robust level of evidence for that.
And we examined several factors related to the natural environment, so urban vegetation. And we also looked at factors that are related to social economic factors, deprivation, etc., and also housing characteristics. And we found that areas with higher vegetation, so green space, were substantially cooler than areas with lower vegetation, but also that those areas with higher vegetation experienced lower heat-related deaths. And then we could conclude that vegetation may offer sustainable climate change adaptation solutions that are cheap and cost-effective. And I guess also we can conclude that this is a clear message to policy and decision makers that perhaps we should be investing more in enhancing our green spaces and the natural environment.
We published the findings recently in Current Biology, and we did find that certain grass species might have more of an impact on respiratory health than others. But with regards to the data from MEDME, that sort of standard general grass pollen data, as opposed to the species-specific stuff, we found that crucially, whilst some species might be having more of an impact than others, the general grass pollen load is still really important for people with asthma and other respiratory health conditions.
Using it, you need to learn a little bit of processing using Python, and that might put off people, but I mean, I had to learn how to do that, and it was fairly straightforward.
Honestly, my own lack of familiarity with Python was the main barrier, but it's easy enough to learn, and there's plenty of guidance and support.
I am Professor Rosa Barciela. I am the Met Office Principal Scientific Consultant in Applied Science, and I'm also the Head of Health and Research across the Met Office. And my role in MEDME started almost from the very beginning, and yes, since then, both Yolanda and myself have been very involved in trying to pull it through into what it is now, the EPHSS.
Hi, yes, I'm Yolanda Pluler at the Met Office as well, and I am the Relationship Manager for our health sector colleagues and all our services and research. So I try and oversee everything that we do that has a health element to it.
I'm Giovanni Leonardi. I'm working for Public Health England in the Center for Radiation, Chemical, Environmental Hazards, and I'm leading the group on environmental epidemiology. The linkage that MEDME provides is an example of a geographic linkage, where we are attempting to look at what is going on around us, in particular the weather and climate, in relation to people and their health and well-being. This is a general feature of this topic, which is, we hope, helped by the MEDME interface, which we are attempting to keep going in the form of the EPHSS, the Environmental Public Health Surveillance System, as part of the core infrastructure for public health data in the country.
So protecting people's health and enabling them to continue to live and flourish and be safe, this is all very important in terms of our relationship with Public Health England and other public health colleagues, and bringing together related data sets that facilitate that effort in terms of looking at past events so that we can predict future events, and also scanning for threats and hazards present. This is all very important, and this data linkage, EPHSS data linkage work has enabled us to more quickly and efficiently answer questions from public health colleagues. So we, instead of having to have a delay and try and establish what data sets are needed by the public health researchers, and we've been able to direct them to this platform so that they can do a lot of the work themselves, because we've done the groundwork.
Linking health data with information and data representing factors that affect health then can help us understand what of those factors we wish to monitor or we wish to understand better in terms of prevention of disease. One challenge is to comply with data protection legislation and regulations, which are there for a good reason, which is to protect people from harm that could come from inappropriate access to data that concerns them.
This accessibility and enabling capability is actually directed to a broader spectrum of stakeholders, from researchers to practitioners to decision makers. And an important part of this as well is that the linkage, the system does preserve confidentiality, which is usually a very important aspect as well of the public health and the public perception of the transparency, accountability, and still confidentiality that is required. The challenges still remain in terms of making the tool sustainable and in also ensuring that it evolves, it stays fit for purpose, and keeps evolving to meet those user requirements that have been set by Public Health England and the public health function, but also keeps integrating the relevant information in terms of observations, so that it's a one-stop shop that integrates all the relevant and up-to-date information that is required to keep pace with that evolution also of the public health sector and their needs. It is very important to emphasize that more than ever, it requires increased collaboration across traditional boundaries and traditional organizations as well. And I think MedMe and the EPHSS are a great example of user-driven tools that are co-designed and co-developed by the researchers, the epidemiologists, the decision makers. But there is an aspect as well in terms of the user domain that relates sometimes on the perhaps more established habits or behaviors. So again, a more interdisciplinary or collaboration, it's definitely, I think, one of the challenges that will come up.
So thinking about this initiative in global terms, the World Health Organization and the World Meteorological Organization have a joint office now. And part of working with this joint office is an initiative to bring the meteorological communities closer together with the health communities in every country. So we're looking at ways to facilitate closer collaboration, more understanding, recognizing that weather and health and climate and health are inseparable, and we need to bring these communities together to address some of the great challenges. And I see this EPHSS data linkage project as a key small part towards addressing those divisions and those barriers between these communities working together. So I would like to see more of this, and hopefully this will be a great case study that we can share globally to demonstrate how these communities could work together.
It's not straightforward to get the right data for a certain idea or objective that a user may have.
I think that this is something that the Met Office is addressing across many sectors, not just health. This is a big drive at the Met Office at the moment, is how to make our data more available and more useful, and to get it out of the office into the wider world and to be as useful as possible. So I think in that context, I think it is definitely something that we need more information and more easily accessible information to the health sector on what data is available and how it might be useful. So I definitely think that is something that we would like to see better facilitated.
We shouldn't believe that having some linkage will magically allow us to understand what's going on. Most of the data is very poorly related to what's going on. And so we have to make a judgment. And so it's a risk to jump to conclusions about a certain factor being really important when in fact it is not, unless we are a bit careful about what we understand of the data, what is missing from the data.
Even if the data and the information is out there, for those who are unfamiliar with new systems, it's just very difficult and could be detrimental, almost to assume that because it's there, it's going to be taken up. So I think there's an element of training and perhaps an element as well of communication, and possibly this video, could be helping in terms of bridging perhaps a little bit of a potential gap there.
To be able to provide evidence in a way that is understandable by decision makers. And this is stretching our capacity to go from just the understanding to the communication, using perhaps different ways of presenting the results when we think about the input that they may have on decisions. And this is, in a sense, it's a neglected part sometimes of the data analysis task, because there is a need for more work on this aspect, and to stay within the boundaries of being the technical people, but at the same time mindful of the language that will help decision makers consider the evidence and then use it for worthwhile decisions.
I'm Bernd Eggen. I work in the environmental epidemiology team at Public Health England as the systems development manager for the environmental public health surveillance system. It's basically addressing the need for public health researchers to access environmental data in an easy fashion and combine it with health data. And so the system currently allows for researchers to look at environmental events. So these could be chemical or biological or radiation events, and also now weather-related extreme weather events. And also there is a module that looks at lead in blood. So the system is very flexible, and there are a number of extensions planned. But what has in the past often been an obstacle is that this data has been available in formats which are sort of more familiar to the meteorological sort of trained user community, and the data came in formats not so accessible for public health researchers. So EPHSS has made data available in very easy to use Excel spreadsheet format, which is sort of typically what public health researchers would use. I think the user interface of EPHSS improves above what is available through the MedMe system. It has a graphical user interface. It allows users also to input postcodes and other geo data formats which are more used in the health community. And we've already seen a number of publications that have used these kinds of formats, it sort of takes the burden away from the user so that they can focus on actually the analysis of the environmental data rather than having to specify the actual format. So let's take a quick look at what the user interface of EPHSS looks like. So here we've already selected the MedOffice dataset interface part of the system. And essentially, you need to go through 5 different kind of specifications, and what you see is you need here first the requirement, whether you want this for a single location or multiple location, a grid location, or whether you're just interested in raw data. Then you specify over what kind of time range you're interested in the data, and whether this should be sort of daily data or hourly data. And then, and this is, I think, where the system sort of offers the user really an advantage over how it was done in MedMe, is that you can select the location, and so you can either get a sort of a graphical pop-up window, and then you can either zoom into a particular place for which you are interested in the data, or you can sort of type it into a search window, and it then finds you the GIS coordinates, and it then will populate this before asking what kind of meteorological variables and what kind of post-processing you're interested in. Opening up to external stakeholders, that's a key importance, because we want EPHSS, and in particular the MedOffice dataset interface, to replace MedMe in the near future. But we're also looking at other data streams. So this is both within the meteorological and climatological community, so that we have maybe climate projections becoming available in a similar fashion to the MIDAS data. And it could be, excuse me, other data streams from other organizations that then can be combined with meteorological or climatological data.
Thank you so much for watching and listening to this video about our exciting project, MedMe. Reflecting back over the now 8+ years of its existence, I find it really exciting and inspiring to see how a small idea has grown and taken hold, and will hopefully help many people, many communities going forward in a better understanding and even prevention of the impacts of climate and other environmental change on both the health of the environment and the health of humans. Thank you very much.